So I hope that you have some feeling inside for 4 levels. And if you need to go back and look at it a bunch of times to remember what the 4 are, that's okay. But within anthroposophic medicine, these 4 levels are really a foundation for approaching things therapeutically. And we could take just about any clinical topic. I think warmth is a particularly interesting exploration because there's good data about it, and thermograms, and honeybee hive images of the winter, and all of these things that can really make it very alive for us. But a kind of physical, functional, sensory, emotional, spiritual, developmental differentiation, when we're fortunate enough to be able to incorporate all of those aspects, it can really be a very beautiful, encouraging, holistic medicine. And this is one vocabulary for that. I'm sure, I have no illusions that this is unique, except that this is a kind of distillation that can be worked with. So part 3, we want to take a little bit of a step, which is that there's this 4-fold aspect to the human being, and then there is also a particular viewpoint of physiology. So within anthroposophic medicine, you'll hear about a 4-fold and then also a 3-fold approach. So working to understand the dynamics of physiology is not new, right? There's a beautiful description of dynamic physiology in Chinese medicine. We can also look at Ayurvedic medicine. And maybe instead of just a polarity of the 2, we've got a 5-fold and relationships of different elements together within Ayurveda. But this is the alchemical formulation. So dynamic physiology is not at all new. And it's important also that we don't get stuck on a literal interpretation of these descriptions, because I think that's some of the challenge. We're just saying during the break that it feels like we're rediscovering some of the things that have been known for a long time, and it's easy to be dismissive of things if we are thinking in literal names, facts, when somebody is actually describing process. We love specific measurements and names. So getting out of medical silos. Modern medicine is very good at the removal and replacement of physical structures and compounds. So I have a patient, a friend I've known for a long time, who needed a shoulder replacement. And he was able to get a custom 3D printed component. It came from France. They did his MRIs here in Colorado and sent them overseas, and he got this component, or this very specific arthroplasty. So we're very, very good at that. We're also very good at synthesizing things. Synthetic hormones can be made very specifically, very purely. So we can swap things out or replace them. In terms of physiology, most treatments, they work to stop or slow a physiologic process. So anything that is a blocker, an acid blocker, a beta blocker, an ACE inhibitor, anything that is an anti-estrogen, antihistamine, anti-inflammatory, antibiotic, we have lots of ways chemically to stop or disrupt a process. And so that leads to a medical approach which mostly relies on surgical interventions or the controlling or suppressing of symptoms. And I didn't realize this for a long time. That was a lot of the medical approach that I was taught. So the question that becomes very interesting is, how do we not just suppress symptoms, but promote healing? Somebody said to me in the last couple of years, medicine is for when you get sick. Health is for when you are promoting being well. This person described these great artifices, huge, huge institutions and buildings, to the processes of being sick, but very, very small structures in terms of promoting healing. So if you have your gallbladder removed, what does the surgeon do to help you heal? So one is to use sterile technique. I would like that. I want somebody to use sterile technique. Pain medicines, bowel rest. But in terms of actually healing from the surgery, there's not a lot, mostly time. And you have follow-up visits to make sure that you're healing appropriately, that you're following the expected course of time. If we give a prescription for a common condition, let's say hypertension, maybe we give a diuretic or an ACE inhibitor. Or depression, we give an SSRI. What kind of support can we offer to make the person better so that they won't need the medicine 2 years from now? If we just use a blocker, we are controlling a process, but usually they're not going to be better 2 years from now, except for maybe time again, or weight loss, or as stress has passed. But time is really a big ingredient in somebody being different. So within anthroposophic medicine, trying to look more dynamically to see, well, how do we help someone actually heal? There's a lot of focus on saying, what are the parts of an illness that are harmful versus helpful? And the example we used earlier of the acute respiratory infections and the earaches, the difference in antibiotic use that was so dramatic across all of those different clinical conditions, that's made possible by differentiating the illness from the body's response, which is a movement towards healing. Because if you just suppress all of the symptoms, you are probably suppressing the healing process as well. So there's that graph. Big difference in terms of antibiotic use and actually a faster return to improvement. Faster time to first improvement. So the first step is processes that are illness and processes that are health promoting. A second part of a lens to foster healing, I think, is having this longer gaze. This is a study, this is 2013, 1,500 patients. This is done in a bunch of centers in Europe. And they looked at symptom scores, physical and mental component scores. And the specific conditions they considered were asthma, anxiety disorders, migraine, depression, attention deficit with hyperactivity, and low back pain. It's a pretty broad spectrum of primary care illnesses. A lot of different body systems. And what they looked for is that they saw with the anthroposophic treatment, the disease score went down in terms of how people were rating their symptoms. And we could see that that specifically, it moved down, and it didn't just improve over this first 6 months, but it went down and it stayed down. So that 2 years later, people had a sustained change. So they looked at symptom scores. They saw it went down. Anxiety went down. Average asthma severity went down. Average migraine severity went down. Maybe it's creeping up just a little bit at 2 years. Then we've got a total score, depression scales, functional ability, and low back pain rating. Symptom scores it down again, depression down, back pain down, functional ability goes up. And then I think this is what's most interesting is the physical component versus the mental component, that people felt better physically and emotionally. Where if we look at the siloing, it's very easy to say, you have a physical illness, you need this treatment, or you have a psychological illness and you need this treatment. Or I don't do that, so you need to go see this other person. And they say, well, you're clearly not in my realm, so you need to go back to that person. This is a way to help people in a kind of a global way. I think this is truly a holistic approach. Lasting improvements we're seeing across different illnesses, different organ systems, and on the level of body and of mind and spirit. So if we look at threefold dynamics, and this is really where we get into the anthroposophic approach, we can say for digestion, digestion definitely has an aspect of breaking down. It also has an aspect of absorption and a kind of mediation of deciding what should go in and what can be left out. If we look at the bones, osteoclasts that are breaking down bone, osteoblasts that are building up bone. Together they create bone remodeling. The kidneys, we've got filtration. And then we reabsorb 90%. Not a very efficient process, really, but an exquisite capacity for homeostasis in that process. Circulation, systole, diastole, immunity, surveillance, and recognition versus inflammation. For the muscles, you need both flexion and relaxation to move. And for respiration, we need to breathe in and we need to breathe out. So actually, we can see different dynamics very easily. This is Diana, the goddess. You can see her bow a little bit here behind her. She's drawing an arrow. Very dynamic figure. Where is her activity? I'll give you a hint. See, well, all right, follow this thought process and see if it makes sense for you. She's gazing, but she's pretty active. She's going to do something in the environment. She's engaging the environment. Okay, where's the main activity here? Right there. I mean, of course, this figure, their little gaze is really fun to look at. But Diana is out, and this is in. And this is much more observation, really looking to see. If we take the whole human being, you know, it's a little bit easier to see with the skeleton by itself. But we can say, oh, there's parts of our body which are most occupied with sensing and observing, which tend to be concentrated in the head. And there are parts of our body where we're most active in the periphery, and they tend to be in the limbs. And that actually, because that very first quote where Rudolf Steiner was talking to medical students, and he talked about bridging from the spiritual moral to the physiologic anatomical, saying this is actually something you can see in the anatomy. That if we look up here, this is a round structure. And this is a linear structure. And that actually even here in the middle, in the thorax, we can see that at the top, there's a lot of roundness. And if we get down to the bottom, to the floating ribs, Well, there's a transition in the middle, and then there's a kind of linearity. And you can even follow 1 bone to 2 bones, to 3 bones, to 4 bones, to 5 bones, 1 bone to 2 bones, to 3 bones, to 4 bones, to 5 bones. There's an actual physiologic expression of changing activity and dynamic. So there's Da Vinci. This is nice because it shows the shape plus the skeleton. And this is actually a diagram that was written not for healthcare and medical doctors, but for teachers. When these ideas were first being worked with, where you've got a roundness of the head and a linearity of the limbs, and then a kind of crescent moon activity in the middle. And this was described as a differentiation between thinking versus willing, with feeling in the middle. We are mostly thinking beings here. We are mostly willing beings here. And we are feeling beings in the middle. Thinking, willing, feeling in the middle. And within anthroposophic medicine, these have the name of a nerve sense system, which belongs mostly in the head, but anytime you have nerve or sensing activity, it's there. A metabolic limb system, and a rhythmic system. It's a challenge because these are specific terms. And if you're trying to read about this for the first time, it can feel like, oh my gosh, you were talking about the fourfold, and now you're talking about the threefold, and I don't know what you're doing, and what does this word mean? And you just said astral? What is the astral? And it takes some time to start to warm into these processes. But what can be helpful is that there are words to describe something that are more global than just saying head. We can say there's actually a system of activity. And this is a nice representation. This is from a book called Functional Morphology. And so here, the nerve sense or the sensory nervous system, the brain, the eyes, the spinal cord, and of course, all of the neural complexes that are in the gut as well. But there's this whole aspect of sensing, perceiving. There's the metabolic system, which within anthroposophic medicine, it's recognized that that's connected to the limbs as well. And of course, it does extend up outside of the abdomen, but mostly it's concentrated there. And then if we look at the rhythmic system, which is in the middle, we find organs that are actually rhythmic, that our heart is continuously alternating back and forth between a contracting and a relaxing. The lungs are constantly inhaling and exhaling. And so we find 3 physical systems, 3 functional systems. A nice way to approach this is a book which is by a doctor called Thomas Breitkreutz. I might have the reference at the end, but he takes this threefoldness and looks at hypertension. It's actually written for patients. It's very accessible. It has a quiz. You can read it and score yourself. Are you one of these types? And that you find there are some people who have a lot of vasoconstriction, who are pale and nervous, and their high blood pressure comes mostly from responsibility and lack of sleep and lack of rest. And you have other people who are metabolic types where diet makes a huge difference, and salt, and they tend to be more red-faced and round. And then for the middle, he describes what's called a chaos type, where things change every single day as to whether you're going to eat or what time you eat or when you go to bed, and there's just no rhythm for your body. And that you can actually develop a differentiated hypertension approach just looking through these three. So that's a little preview of the threefold. I just wanted to finish with this quote again. You will have to experience what is called heart warmth in such a way that you will feel this warm heart right into the physical. You will have to find the way from the scientific physiological to the spiritual moral, and from the spiritual moral to the physiological anatomical. And so this is a modern medical view which can learn from the Greek physicians and their knowledge with also very modern applications. Thank you for your attention and participation.